I want to tell you about Priya. She is 34 years old. She is an engineer. She is sharp, organized, and very good at her job. And for 10 days out of every month, she feels like a completely different person. The week before her period, Priya gets bloated, her breasts hurt, she cannot sleep well, she gets headaches that ibuprofen barely touches. She cries at things that would not normally make her cry. She snaps at her husband and then feels guilty about it. She cannot concentrate at work the way she normally can. She has been tracking this pattern for 3 years. She has brought up at 3 different appointments. Each time she was told that some discomfort before your period is normal. She was told to try ibuprofen. She was told to consider birth control. She was never given a name for what she was experiencing. She was never told how common it is. She was never offered anything um, beyond manage it and move on. Priya is not being dramatic. Priya has a clinical condition that affects hundreds of millions of people worldwide, and she has never once been told that.
Today, we're talking about the menstrual cycle, what it actually is, what PMS is clinically, what conventional medicine offers, and something I'm personally exploring that I'm excited to share with this community is herbalism, the oldest form of medicine in the world and still the most widely used, and how it can be used to support menstrual health and how it has been used to support menstrual health for thousands of years. And but men, before you turn off, this is for you too. Because look, if you're a dad, if you're someone's partner, if you don't understand what we're talking about, you can't talk to them, you can't support us. That's something I realized with my relationship with my dad and with my partner, the things that I go through as I get older. How can they talk to me about it if no one's talking to them about it?
Right.
If you're in healthcare, you could be in healthcare too. And so don't turn off the channel. This isn't a woman's episode. This is all of us episode. And we have some men who are taking care of their moms. So, hey,
Yeah. So this episode is for those people, it's for everyone, but this episode is for Priya. It is for every person who has been told that they experience every single month this is for everybody that has been told that what they experience every single month is just something to deal with. It is not. And there is more available to you other than ibuprofen and just pushing through. If you're new here, welcome to the Melanin Initiative. I'm Geraldine, and I co-host the Melanin Initiative along with Kimberly and Alicia. Here, we simplify medical information into language that you can understand. We create a safe space to ask your questions and to share our nursing perspective. We're a health literacy podcast, and when we say health literacy, we're talking about your ability to obtain information, to understand that information, and to use that information to manage your health and advocate for others. Our mission is twofold. One is to simplify complex health information, and two is to elevate the expertise of nurses, spotlight the diverse career opportunities within the healthcare industry, and inform our peers how to leverage their expertise as clinicians and entrepreneurs. If you haven't already, subscribe on Apple Podcasts or Spotify and leave us a 5-star review. Thumbs up the video, leave a comment, and share the show with your friends. This shows the algorithm that this content is important, so that when people like you look for information like this, we'll show up higher in your search results. As a reminder, this show is for educational purposes only. The opinions expressed are our opinions alone, and they are not a representation of any of our affiliations. If you are experiencing a medical emergency, you should seek medical attention and medical guidance from your healthcare provider. If you are having a physical emergency, call 911. And if you're having a mental health emergency or know someone who is, you can call 988 or text 741-741.
Okay, what is the menstrual cycle? The menstrual cycle is a monthly hormonal process that prepares the body for possible pregnancy. This is a great combination with our topic on STIs and gonorrhea and contraception. If you haven't watched those episodes, we invite you to click on our playlist so you can see those, watch them with your family, play them in your classroom, at your youth ministry. It is driven by...
You're a little muffled.
Oh.
Sorry.
Yeah, no, that's good. Okay. 3, 2, 1. What is the menstrual cycle? The menstrual cycle is a monthly hormonal process that prepares the body for possible pregnancy. It is driven by 4 main hormones: estrogen, progesterone, follicle-stimulating hormone, and luteinizing hormone. These hormones rise and fall in a specific pattern each month, and that pattern drives everything that happens in the cycle. There are 4 phases. The menstrual phase, the period itself, when the uterine lining sheds lasting 3 to 7 days. The follicular phase, estrogen rises, the body prepares to release an egg, and the uterine lining rebuilds. Ovulation, the egg is released, estrogen peaks, then drops. In the luteal phase, progesterone rises to prepare the body for possible pregnancy. If no fertilization occurs, so that sperm and that egg don't meet, both estrogen and progesterone drop sharply. That drop is where PMS lives. We'll put up a graphic to make this a lot easier to understand. Now, PMS, also known as premenstrual syndrome, is a collection of physical, emotional, and behavioral symptoms that occur in the 1 to 2 weeks before the menstruation and resolve within a few days of the period starting. It's not a mood disorder, and it's not a character flaw. It's a physiological response to those hormones fluctuating. Between 20 and 40% of people who menstruate experience PMS significant enough to affect their daily function, include going to work, showing up for school, being able to pay attention. Up to 8% experience PMDD. This is premenstrual dysmorphic disorder, which involves significant mood disruption, including depression, anxiety, and in some cases, suicidal ideation, which we've also covered in our mental health playlist with Kelsey Wilson. Now, PMDD is a recognized clinical diagnosis. It deserves clinical attention.
Wow, ladies, we go through a lot. This happens once a month for 20 to 40% of the women who are born women. This is crazy. But Priya has been experiencing this for 3 years. 3 years of 10 affected days per month. More than a month of impaired functioning every year. And nobody gave it a name. So who was most affected? People in their mid-20s to mid-30s, adolescents whose cycles are still establishing hormonal patterns, people with a history of depression or anxiety, people under high chronic stress because cortisol interacts directly with the hormones that govern the cycle, and people with deficiencies in magnesium, calcium, and vitamin B6, which play a direct role in how our nervous system handles hormonal shifts.
The research on racial disparities in menstrual health is limited, and that gap is itself a problem. What we do know is that Black and South Asian women are more likely to have their menstrual symptoms dismissed and less likely to receive referrals for conditions like PMDD and endometriosis. Priya's story is not unusual in South Asian communities where menstruation is often treated as private matter and symptoms are normalized rather than investigated.
Exactly. So let's go a little bit deeper. So during the luteal phase, progesterone rises. Progesterone has a calming effect on the nervous system. It supports sleep. It reduces anxiety. When progesterone drops sharply before menstruation, that withdrawal triggers a cascade. The nervous system becomes more reactive. Sleep quality drops, and mood regulation becomes harder. At the same time, the drop in estrogen affects serotonin, which is the neurotransmitter most connected to mood stability. Lower estrogen means lower serotonin activity. And this is why PMDD specifically responds to SSRIs or antidepressant medication typically used for depression, which in PMDD can be taken just during the luteal phase rather than every day. Each physical symptom has its own mechanism. Bloating happens because estrogen and progesterone affect how the kidneys handle fluid and sodium. Breast tenderness happens because estrogen stimulates breast tissue. Cramping is driven by prostaglandins, chemicals that are released by the uterine lining as it prepares to shed. High prostaglandin levels mean more intense cramping. Headaches track with the estrogen drop that precedes menstruation. My goodness. Woo!
It's no wonder we're not having these conversations.
Right. We had a whole sleep episode and just, talking about these things. It's like, wow, we didn't even address the fact that maybe they're in that case of the cycle where, progesterone is low and serotonin and all the things, right? So like there's so many different reasons why people experience what they're experiencing. And it could be PMS.
Yeah. And because we also know that people can have, their period can be irregular. They might be going through this more often than someone who's not as regular. And then even though your sleep is disrupted during that period, the fact that your sleep keeps getting interrupted could long how often you experience this. And you mentioned the cortisol hormone, that's our stress hormone, which affects our sleep. Okay, so make sure you go ahead and watch our video on sleep, which we talked about. And we talked about non-pharmacological options that you can use to improve your sleep. Now, every symptom that Priya described has a documented physiological, that means something in your body, your physical body, physiological mechanism. And she was told to take ibuprofen. That is a gap that we're here to close.
Absolutely. So PMS is diagnosed clinically. There is no blood test. The most valuable tool is a daily symptom diary tracked over at least 2 consecutive cycles, recording every symptom, when it starts and when it resolves related to the period. This is something anyone can start today. No prescription needed, no appointment needed. Start today, tonight, whenever. Conventional treatment options include hormonal contraceptives to stabilize fluctuations. SSRIs are those antidepressants for the serotonin component, especially in PMDD. NSAIDs, or that's that ibuprofen, the naproxen, Aleve for cramping and pain. Diuretics for severe fluid retention, and lifestyle interventions such as aerobic exercise, dietary changes, and stress reduction, that cortisol, which have solid evidence for mild to moderate PMS. For our nurses and nurse practitioners, when a patient presents with cyclical symptoms that affect functioning, a 2-month symptom diary is your most valuable diagnostic tool. Do not dismiss the pattern before you document it. PMDD is a DSM-5 recognized diagnosis with evidence-based treatment options. It deserves a treatment plan.
And for our adolescent patients and caregivers, period symptoms that consistently disrupt school, social life, or daily activities are not a normal part of growing up. They are a clinical signal. An adolescent who misses school every month because of her period deserves a diagnosis, not a heating pad and a pat on the head. Yeah.
And that's why our men have to watch this episode too, because that just, my dad, he's a classic pat on, even to this day. I love you, Dad.
So our takeaways from this section: PMS is a hormonal event with documented physiological or physical mechanisms. If your symptoms are consistent, cyclical, as in they happen every month, the same time, same way, and disrupting your life, you deserve a diagnosis. Start a symptom diary today, 2 cycles, bring it to your next appointment, and ask your care team to take it seriously.
Yeah, and since we are talking about this being a documented mental health disorder, we want to shout out our friends to the show, Kirby Williams, who's a psychiatric mental health nurse practitioner in Richmond, Virginia, Dr. Ani Adabong, who sees clients in Maryland. They're 2 of the co-founders of the Society of Psychiatric Mental Health Nurse Practitioners of Color, and they have their annual conference, I think in September. We're looking to have them on as a panel. And Kirby is actually one of our most watched episodes when it comes to bipolar. We have a long list of episodes on mental health. Actually, that's the most topics we've covered without even trying, has been mental health. So we invite you to go check that out. And they're just some of our guests who see clients in the DMV area, DC, Maryland, and Virginia. We also have Michael Whitehead, Kelsey Wilson. I hate when I do this because I think I'm going to forget somebody, but I think that's a good one for the DMV. There's other people who cover other areas, but I think they're the ones that, and oh no, she wasn't. Yeah, that's it. So you can check them out over there. Now, I want to share something, like I mentioned at the start of the show, that I have a new hobby. And so I'm being very transparent about that because I think honestly, honesty matters all the time. There was some on my page would be like, "Are you serious?" I'm like, "No. I'm always serious." I get paid to be serious. Or they'll be like, "Can I be honest with you?" Well, what have you been doing this whole time?
Right, I would hope. Mm-hmm.
So this is a growing area of clinical interest for me, and I'm bringing it to the podcast because the consumer is actually demanding it. Now, when I was in NP school almost a decade ago, I had a rotation in integrative medicine, and I didn't appreciate it because I was like, this isn't preparing me for boards. And that was the only thing you're thinking about because that's the only thing school is there for, is to prepare you for that exam. But I appreciated it as a patient because I am a tree hugger. I love plants, right? And I just have strong beliefs about what I think our body can do for itself. And so when I learned about herbalism not too long ago, I just fell in love and I haven't looked back. So me and my mom are actually studying together. And there's different forms of herbalism, which we'll get into, but you're going to hear more about that. But the consumer is actually demanding that too. The interest in integrative medicine, so things that don't require prescription, is growing from the public. And a lot of our nursing time with patients is arguing over taking medications that they don't want to take and that they say don't help them. And then we have to give more medications for the side effects. And you know, when I was telling you guys my new perspective, think about it. When you're practicing on the floor as the bedside nurse, you can't answer the phone. You can't help that patient that's falling. You can't help your colleague because you got to pass this med. That's just like at the top of your list. If there's 20 check boxes to check in the next hour, the only one that really has your attention is the medication one. And in long-term care, they actually have a med nurse. And they can't be pulled to do anything else. So just my thoughts with the public. So it's called herbalism. And I want to explain what that means because the word herbalism covers a wide range of things and not all of them are the same. And I'm a newbie. I'm sure I'm taking you along this journey with me. So I want to hear your comments in the comments. We're going to have some people who have been doing this for a long time on this show. And so we'll continue to have these conversations. But it's been used the longest. It's still the most widely used. And it's the most affordable. And at the heart of it, what I love is that you give the information away for free. That is at the heart of it because no one can own this. God owns that. Okay. So it's the oldest form of medicine in the world. And before pharmaceuticals, before hospitals, before medical schools, plants were medicine. Every culture on earth developed its own system of botanical healing. We have our traditional Chinese medicine, Ayurveda, that's ancient Indian medical system that Priya's own ancestors likely practiced. Our indigenous healing traditions across every continent, African botanical traditions, I should have brought my books over here, European folk medicine, all of them developed independently, arrived at many of the same plants, for many of the same conditions. That is not a coincidence. That's a convergence of evidence. And those plants, guess what? They're used to make pills.
Right. And what's even more fascinating is guess who carried this knowledge? Largely women, midwives, healers, the women in the community who knew which plant eased the cramps, which root supported the nervous system, which tea helped the heavy bleeding. This knowledge was passed down mother to daughter for thousands of years. It's actually funny because my friends, they're from Trinidad, and whenever I'm at their house or they come to my house, they tell me my tea game is low. They're like, "Girl, you gotta get your teas up, okay?" And I'm like, "Okay, well, buy it for me." But on top of that, I'll be like, "Oh, I'm having cramps." They're like, "Oh, drink this raspberry tea," or "Oh, I'm having this particular, GI issue." They're like, "Oh, there's a tea for that." So just herbalism, it's a real thing. People still practice that today. And it's just I love it all.
Yes, that's the same for my family. Well, I don't practice it as much as I should, but coming from a Caribbean background, my parents are from Haiti. Same thing. Lots of herbs growing up. I didn't always like drinking the teas that my mom would make me, but they would pull they'd grow some of their herbs and leaves in the backyard, rip them out from, back there and then throw it in the pot and make teas for us to drink. Sometimes forcibly, but they did cure the ailments. But they're nowadays the teas are becoming a lot less bitter because I was used to drinking really bitter teas growing up, which is why I hated it initially. But now they're finding ways to make them more palatable.
I have learned about bitters outside of alcohol. Like now when I ask people if they know bitters, the first thing they say to me, they're like, for drinks. Actually I've learned about the medicinal benefits of bitters. So now I have an appreciation for bitters and we'll do that another episode. But yes, and I think in America, at least so American culture, I think it's not as prevalent, but in cultures like Geraldine's, it's you grew up like that. Mm-hmm. And since I've delved into this, then you start thinking back because you think, oh, I'm new to this. But then you think back, it's like, oh, my mom used to make this onion cough syrup. And now we've been having these different conversations. And I tell my patients right now, I say, look, whatever your grandma taught you, guess what? She was right.
I remember that onion cough syrup. Oh my gosh, my mom made that too.
I was like, all the stuff your grandma taught you, I'm about to tell you the same thing. Mm-hmm. And it took me thousands of dollars to get this information. And grandma, she didn't have any of it. Mm-hmm. Mm-hmm. So that tea game, I would like to know how how they help stack you up there.
I got you.
And I'll throw my books up on, we'll put a little screenshot here. Okay. And then it became dangerous. Okay. So first you have all these women using these plants and people were healing. I was telling the girls in my clinical practice, I don't hear my patients use that word. So beginning in the 14th and 15th centuries in Europe, the persecution of women were called witches because they were healing people. So they were accused of witchcraft, which included your healers, our midwives, and the herbalists. This resulted in deaths of tens of thousands of women. Historians document between 40,000 to 60,000 executions during the witch trial period. Women made up the overwhelming majority. Many were killed specifically because of the healing knowledge they carried. That knowledge transfer was violently disrupted, and it has never really been recovered. But that's changing. I think since the pandemic, it's changed because people were like, I got to do something.
Right. It is worth naming who benefited. As women healers were persecuted, the emerging male-dominated medical professional gained legal authority. The knowledge that had been held by communities, accessible, low-cost, passed down freely, was replaced by a system requiring formal credentials and paid consultations. That is not a coincidence. That is a documented historical transition.
Now, clinical herbalism, because there's different forms of herbalism. The first one is family herbalism. So this is just you picking up a couple books and healing your families. Geraldine says she can't sleep. I say, hey, take this mixture. Alicia says she wants clear skin. I say, take that one, right? And you just start there. And you could stop there. Then you can move to community herbalism, where now you share that information with the community. And if they want you to make something, and if you choose to sell it, then you can do that. But the information should always be free. Then you can go to clinical herbalism, which of course piques my interest because I'm a clinician. And that's where you're actually using it to help treat patients. There's people who go get the herbs. They're called foragers. And then the people who like distribute them. It keeps going. It's a long list. But the first one is to start with your family, which I just love that one. Now, clinical herbalism today is distinct from the traditional herbalism in one important way. It applies evidence-informed methodology to botanical medicine. And there are actually degree programs out there here in America. It asks, what are the documented mechanisms of this plant? What does the research say about safety and efficacy? And how does it interact with medications? It's very important. Plants are not, they also have side effects. Mm-hmm. What is the right preparation, dose, and duration? It bridges traditional knowledge with modern clinical standards. And, a lot of times you'll hear us say it because that's how we're trained. There's not enough data. That goes back to that system we told you about, the Flexner report. If the goal here is to make money and a profit, I don't make a lot of money with plants. So I'm not going to put money into that research. So I can continue to keep saying there's not a lot of research. But when I go to conferences that are all about integrative medicine, guess what they know? That there's a lot of data. And they're telling me something completely different. And I always say, why aren't we talking to each other? Because there is a lot of data. Now, could there be more? Absolutely. But there is data that's already documented. Okay, so this is different from the wellness supplement industry, which is largely unregulated, frequently makes unsupported claims, and often sells products that are poorly standardized or contaminated. And we're not really doing anything to change that because we want it to stay that way. Now, clinical herbalism respects the plant, respects the evidence, and respects the patient enough to be honest about what we know and what we do not know yet. For the South Asian community specifically, Ayurveda has always used botanical medicine as a cornerstone of treatment. Puriya's ancestors had a sophisticated herbal pharmacopoeia that addressed menstrual health specifically. The idea that plant medicine is primitive or unscientific is a colonial narrative. It is not a clinical one. I will say real quick, there was a doctor, she came on and she was telling everyone, she was making like a reel. She told everyone, don't take sea moss. It has too many nutrients. It's going to interact with your thyroid medication. So I look at the comments, right? Because you look at the comments. And you know what everyone said? They said, oh, thanks, doc. I'll stop taking my medicine. You said yourself it has so many nutrients. Why would I keep taking this medicine? And actually, she didn't say thyroid medication. She said other medications. But if you do have thyroid disorders, it's not recommended. But everyone in the comments was like, thanks, doc. Since it has so many nutrients, I'll take that instead of this medication that's not helping and doesn't make me feel better. And I just thought that was a little bit ironic. Yeah, hilarious. Because she was very serious.
Well, clinical herbalism is evidence-informed botanical medicine. It is the oldest healing tradition in the world. It was largely carried by women who looked like us. Its suppression was not accidental, and its return to clinical relevance is worth paying attention to.
So I'm going to draw from clinical herbalism education, including the work of Rosemary Gladstar, one of the most respected voices in American clinical herbalism. And I want to be transparent. Some of these plants have documented mechanisms that align with conventional physiology. Some are rooted in traditional knowledge that precedes our current research methods, and I will tell you which is which. So let's start with that cramping and pelvic pain. You can look at wild yam, and they all have like a genus and species name that I cannot pronounce. So I'm going to go with the one I can pronounce. Now, it has antispasmodic properties. It helps relax smooth muscle so that uterine cramping is driven by the prostaglandin-induced muscle contractions. Wild yam's antispasmodic mechanism is documented and directly relevant to this process. It's used to support progesterone and estrogen balance. Dong Quai is one of the most used herbs in traditional Chinese medicine. It improves circulation to the pelvic floor and supports regularity of the cycle. It also has documented effects on uterine tone and blood flow. Important to note that it's not appropriate during pregnancy and it can interact with your blood thinner. This is an example of why clinical herbalism conversation with your care team matters. Now, for estrogen clearance, and this connection really surprised me, the liver processes and clears excess estrogen from the body. When the liver is overburdened, excess estrogen accumulates. That accumulation contributes to worse PMS, breast tenderness, hormonal acne, and mood instability. Supporting the liver is a key botanical strategy for reducing estrogen dominance. Burdock root and yellow dock are classic liver tonics that aid in clearing metabolic waste, including hormonal acne that tracks with estrogen fluctuation. That's what I'm drinking these days. Now, dandelion root, one of my absolute favorites, the root specifically targets liver congestion and bile production. This is not a weed. You can get it as a supplement. I go to Whole Foods. I buy the fresh plant. And you can get it in herb form. This is a plant with documented hepatoprotective properties used medicinally across multiple traditional systems. Oregon grape root, it stimulates digestion and liver clearance of excess hormones.
Thanks, Kimberly. So yes, dandelion is on this list. And the weed people pull out of their lawn is supporting liver function and helping clear excess estrogen. That knowledge existed. It just was not passed down to most of us.
Now for stress, right, which impacts a lot of us, whether you're the patient or the clinician, we're both going through a lot of stress. That's why that sleep episode is so important. Now, licorice root, it supports your adrenal function. This is an organ that sits on top of your kidney. The adrenal glands produce cortisol. You've heard us say the stress hormone multiple times. It amplifies your PMS symptoms. That means it makes them worse. Licorice root's adrenal supportive and anti-inflammatory properties are documented in research literature. With long-term use, it can affect your blood pressure. Another reason you have to talk to your care team about it. For fluid retention, dandelion leaf, as distinct from the root, is a potassium-sparing diuretic. It helps the kidneys flush excess fluid without depleting potassium, the way some pharmaceutical diuretics can. So for people who experience significant bloating before your period, dandelion leaf tea is a gentle and evidence-informed option. If you're on a blood pressure medication, this is a great conversation to have with your healthcare team. For nutritional support, nettle leaf. It's extraordinarily high in iron, calcium, and vitamin A. Before menstruation, the body is preparing you for blood loss. Nettle provides the minerals the body needs to support that process and regulate fatigue that follows a heavy period.
Here is the practical framework. If you want to explore botanical support for PMS, talk to your care team first. Some of these herbs interact with medications. Sourced from reputable herbalists or clinically oriented botanical companies that provide standardized preparations and third-party testing. Start one herb at a time so that you can observe your response. Botanical medicine is real medicine. It has real interactions and real contraindications, so treat it that way. For those whose families come from traditions with rich botanical medicine histories like myself, your grandmothers may already know this. The teas, the tonics, the practices that have been in your family for generations. That is not superstition. That is traditional medicine. Clinical herbalism is the bridge between that tradition and the evidence-informed standards that help us use it safely today.
And I was telling the girls, I get some of my products from a company here called The Power of Sea Moss, and they have agreed to come on the show. So depending on when you're watching this, that episode might already be available. Shout out to them. Now, every PMS symptom has a botanical counterpart with a documented physiological mechanism. So cramping, wild yam. Estrogen clearance, burdock, dandelion root, Oregon grape. For fluid retention, that's that dandelion leaf. Adrenaline stress, licorice root, not the same as Twizzlers. And for nutritional depletion, nettle. This is not a replacement for conventional care. It is an addition to it. And it is a tradition that our ancestors almost certainly practiced before it was taken away from them.
A heart attack does not always look like the movies. It does not always come with someone clutching their chest and falling to the floor, especially not in women, and especially not in Black and brown women. Here are the signs: chest discomfort, pressure, squeezing, fullness, or pain that lasts more than a few minutes or goes away and comes back. Discomfort in the upper body, one or both arms, the back, the neck, the jaw, or the stomach. Shortness of breath with or without chest discomfort. And other signs that women more commonly experience include nausea, lightheadedness, and unusual fatigue that comes on suddenly and feels different from normal tiredness. Women are more likely than men to have a heart attack without classic chest pain, and research shows that women's symptoms are more likely to be dismissed by care teams and by themselves. Do not dismiss yours. If you think something is wrong with your heart, call 911. Do not drive yourself to the hospital. Do not wait for symptoms to pass. Aspirin may help if you are not allergic, but call 911 first. Know the signs, trust your body, act fast. This message is brought to you by the Melanin Initiative Podcast, where we simplify health information so you can advocate for yourself and the people you love. Find us on Apple and Spotify. So before we bring Priya back, here are your action items. If you are a patient or a caregiver, start a symptom diary today. Track every symptom, when it starts and when it resolves relative to your period. Do this for 2 cycles. Bring it to your next appointment and ask specifically, do my symptoms meet criteria for PMS or PMDD? If you are interested in botanical support, ask about interactions with any medications you currently take. If you are a nurse or nurse practitioner, cyclical symptoms that consistently disrupt functioning deserve documentation and a clinical diagnosis. A 2-month symptom diary is your most valuable tool. PMDD is a DSM-5 diagnosis with evidence-based treatment options. If clinical herbalism is of professional interest, the American Herbalist Guild offers continuing education pathways. If you are a healthcare entrepreneur and cosmetic MP, hormonal fluctuations drive skin changes your patients are presenting with every month, such as acne, flushing, inflammation. Asking about cycle patterns at intake is within your scope and improves your clinical outcomes.
Absolutely. So let's go back to Priya. After listening to this episode, Priya started a symptom diary, 2 cycles. She brought it to a new provider who reviewed it with her and confirmed that her symptoms met criteria for moderate PMS with a possible PMDD overlap. She was offered options, hormonal support, an SSRI during the luteal phase only, and a referral to an integrative provider who could discuss botanical support. That integrative provider could be a physician, NP or PA, who has done some education, so they might call themselves an integrative specialist, as well as our naturopathic and homeopathic providers. Now, Priya chose to start with lifestyle changes and botanical support first. Dandelion leaf tea for the bloating, nettle leaf during the week before her period for energy, a magnesium supplement, which has strong clinical evidence for PMS symptom reduction, and sleep. She tracked her stress levels and noticed a clear connection between high stress weeks and worse symptoms. 3 months later, 7 of the 10 days that used to be lost to her are now functional again. She's not cured, she's informed. She has a framework and she has tools. She told her provider, nobody ever explained my cycle to me like this. I thought I was just bad at being a woman. And this, if you want help tracking your cycle, there's got to be an app out there. And if you don't find one, you create it yourself.
1000%. And it just makes me so sad that she thought that she was bad at being a woman. That is what 10 days of dismissed, unnamed, untreated symptoms does to a person over time. It makes them question themselves instead of questioning the system that has failed them.
Priya was not bad at being a woman. She was underserved by a system that normalized her suffering instead of naming it. 1 symptom diary, 1 provider who asked the right questions, 3 months of informed self-advocacy. This is what health literacy makes possible.
And that's why we're here today. Today, we covered the 4 phases of the menstrual cycle, the hormonal mechanism behind PMS and PMDD, who's most affected and why, conventional diagnosis and treatment options, an introduction to clinical herbalism and its historical context, and botanical support for PMS organized by symptom and mechanism. This is the first of what I expect to be several episodes on clinical herbalism as I continue my education in this field, and I'm grateful to share this journey with the community. And I was going to say something about the app. If this episode gave you something, share it with at least one person. Someone in your circle is Priya. They have been managing 10 days a month of symptoms alone, telling themselves it is normal because nobody gave them the language to ask for more. Send them this episode. Find us on Apple and Spotify. Leave us a 5-star review. This podcast exists because of this community. We get these topics from you all. And if you are a nurse practitioner who wants to go deeper on business and clinical side of healthcare entrepreneurship, I invite you to visit the Mahogany Dermatology blog and consider becoming a founding member of the Alliance of Cosmetic Nurse Practitioners. The links will be below in the description box. If you found this information helpful, check out our episodes on our playlist on women's health. We thank you all for watching, and we'll see you next time.